afternoon, everyone, and welcome to today's Public Health Ontario's Microbiology Rounds presentation on AI Technologies in Public Health Part 1, launching the Automated Opioid News Event-Based Surveillance AONES tool. My name is Diana Sun, and I am a medical resident in the Communicable Disease Control portfolio, and I have the pleasure of moderating today's session. Before we begin, I do want to mention a few housekeeping items. So one, the chatbot has been disabled to limit any distractions during this presentation. Please use the Q&A pod if you have questions during the session. A discussion and question period will follow this presentation. And if at any point during the session you have any technical issues, please email capacitybuilding@aoahpp.ca. That's capacitybuilding@oahpp.ca. I would also like to state, as moderator of this session, I don't have any conflicts of interest to disclose. So it's now my pleasure to introduce the speakers for today's presentation, Allison Meyer and Nancy Slip. Allison Meyer has an MPH from Queen's University. She is a research associate at kflaphi.ca Public Health and is the data scientist associated with the ACEs program. She has over 10 years of experience working in public health surveillance and program evaluation. Allison is passionate about using data visualization techniques to improve reporting of public health surveillance. Nancy Slip has a PhD in environmental chemistry from the University of Toronto. She is a research associate at kflaphi Public Health and adjunct assistant professor in the Department of Public Health Sciences at Queen's University. Her main professional role is as projects manager for the ACEs program, and she has over 10 years of experience working in public health surveillance and has special interests and expertise in syndromic surveillance, wastewater epidemiology, and knowledge translation. I'm going to pass this on to Allison. All you.
Sorry. Thank you, Diana, and thank you all for coming today. We are very excited to be here to launch our new tool, the Automated Opioid News Event-Based Surveillance System, which we call AONES because that is simply too much of a mouthful for me to repeat all that many times. This tool was built out of a locally driven collaborative project funded by Public Health Ontario over the past year. Before we begin, I would like to start with a land acknowledgement. We, here in kflaphi, live, work, and play on the traditional lands of the Haudenosaunee, Huron-Wendat, Mississauga, and Anishinaabe nations. In today's meeting, we have representatives from across Ontario, and so I would like to ask you to take a moment to reflect on the Indigenous nations whose traditional land you are currently on. In our reflections, we thank them for the care of the land from time immemorial and consider the impacts of settlers. Furthering yesterday's observances for the National Day of Truth and Reconciliation, I ask you to reflect on how we can personally and professionally work to implement the recommendations of the Truth and Reconciliation Commission in our communities and across the country. Beginning with a few introductions, my name is Allison Meyer, and I'm a research associate at kflaphi Public Health. I am the lead on this project alongside two of my colleagues. Nancy Slip, who will be presenting alongside me today, is also a research associate at kflaphi Public Health and an adjunct professor at Queen's University in the Department of Public Health Sciences. Our third colleague, Alex Hamilton, is a research associate and registered nurse at kflaphi Public Health. But before we begin, a disclaimer on behalf of Public Health Ontario, who is hosting this webinar. This presentation was created by myself and my colleagues, but will be published on the PHO website as outlined in their terms of use. PHO is not the owner of this content, and any application or use of the information in this document is the responsibility of the user. PHO assumes no liability resulting from any such application or use. Also, my colleagues and I have no conflicts of interest to declare. There are 4 learning objectives to today's presentation. 1, to identify potential uses of artificial intelligence, AI, in supporting event-based surveillance systems. 2, to describe how the AONES tool can be used to support public health surveillance and harm reduction activities. 3, to be able to use the AONES tool to retrieve information on the unregulated drug supply, and finally, 4, to interpret the AONES data in light of the limitations of event-based surveillance systems and the application of AI. Today, we will start off with a quick background, followed by an introduction to the project. This will be followed by the main event, a walkthrough of the tool itself. We will then summarize the findings of tabletop sessions we did with potential users of the tool to understand its strengths and limitations. And finally, we'll have an open-ended question section. But first, the background. As I'm sure most of you are aware, the drug poisoning crisis has worsened dramatically since the introduction of fentanyl in 2016 and was only exacerbated by the COVID-19 pandemic. Changes to the types of opioids in the unregulated drug supply and an increase in their availability has resulted in an increase in substantial harms to persons and communities through rises in substance misuse, hospital visits and admissions, overdose, and deaths. For example, the number of emergency department visits peaked in 2021 at a rate over 4 times greater than that of the rate in 2015, and the number of deaths due to opioids increased by 2.5 times from 2015 to 2022. The increasing risk from the unregulated opioid drug supply has resulted in an investment in surveillance systems to track the harms caused by opioids. Significant effort has been made by all involved parties to ensure timely reporting in these systems. For example, ED to visit data and hospitalization data from the Acute Care Enhanced Surveillance System, ACES, and from CIHI, mortality data from coroner's reports, data on harm reduction activities and prescriptions from the Opioid Drug Policy Research Network, ODPRN, and newly released information on the EMS opioid response. These methods provide critical information for quantifying the impact of opioids in Ontario. But while these systems provide this critical information, there is still much they do not capture or do not capture fast enough to drive immediate public health action. Current surveillance systems are designed to capture the same type of information over time, which is important, but this rigidity decreases their flexibility and therefore their ability to adapt to changing human behaviors. For example, fewer emergency department transfers after overdose events mean hospital-based indicators may miss these events, and changing outcomes, for example, new contaminants resulting in unusual outcomes like wounds with xylazine, that are not counted in traditionally defined opioid-related outcomes. Additionally, interviews with local harm reduction workers suggested that in our area, these types of events tended to spread eastward, but at present, there were no systematic tools to track these events geographically. We know that there is anecdotal and word-of-mouth cross-jurisdictional information sharing about emerging threats within the people who use drugs community. We believe that there was an opportunity to build a near real-time surveillance system that could aid in this. How? By using large non-traditional data sources and looking for unusual events, or a type of surveillance system called event-based surveillance. With these large data sources, we need different methods to extract and synthesize information, which provides an opportunity to use AI to aid in the automation of this task. What is event-based surveillance, otherwise known as EBS? This table from the Public Health Agency of Canada does a good job of explaining EBS by comparing it to surveillance systems we are more familiar with. Indicator-based surveillance systems is just a technical term for what almost every surveillance system we think of is. For example, numbers of syringes provided or number of opioid-related ED visits are both indicators in these types of systems. Unlike these systems, which measure specific things, EBS systems are more open-ended and they look for both known and unknown diseases. In the case of opioids, this means looking at both known outcomes, for example, overdoses, and unknown or novel outcomes. However, the most notable difference in the two systems is the information type and data sources. Rather than relying on structured information from health system infrastructure, the data in these systems are unstructured or not organized in a predefined manner. For example, full text. The data sources can be quite broad, from official sources, news media, social media, and all other online media. The type of information gained from EBS systems is often less specific than traditional surveillance systems and may result in false positives or signal events that haven't actually happened. As such, public health action from these systems require more context, but they can provide earlier warnings than other systems. One of the main difficulties with EBS systems lies in the difference in data sources and structure. Broad data sources of unstructured data can be much more time-consuming to assess and synthesize. Simply put, there are 5 stages to an EBS. 1, compiling the items from the data source, which could be as wide as the whole internet. 2, filtering those items to only those that are relevant to the health issues included in the EBS. 3, from within those filtered items, taking only the relevant information. 4, in some way synthesizing that information, which may not be in traditional numeric formats like we are familiar with for indicator-based systems. And finally, 5, sharing that information to the relevant parties who can act on it. Given the likelihood of false positives, typically the stage results in the relevant parties doing work for further verification of the event being signaled before taking appropriate public health responses. So, to provide a very brief background on AI, or more specifically, natural language processing, or NLP, which is a subset of artificial intelligence. NLP focuses on giving computers the ability to understand text similar to how humans can. Historically, its techniques have powered services like computer translation, chatbots, and digital assistants. Over the past year, its use has exploded in terms of generative AI, things like ChatGPT, or what we call large language models, LLMs. A combination of NLP techniques, from rule-based models to hosted models to the use of LLMs, can be used by EBS systems to support the various steps in their data processes. Before we move on to the tool itself, I want to give a brief background of the LDCP project and the scoping of it. This is only a brief overview, and a full description of the project and the data process for the tool is available on the website that hosts AONES, kflaphi.ca, that is kflaphi.ca. I also want to emphasize from the start that AONES is an initial project, a test case of an idea, if you will. We have many ideas for expansion of the tool within the unregulated drug supply specifically, or for other public health topics. So this project, as I said at the beginning, was a locally driven collaborative project funded by Public Health Ontario, which aimed to develop an event-based surveillance system for detecting and tracking emerging opioid-related trends and drug supply contamination events. We do this by using open news data published in North America and natural language processing to extract and synthesize this data. We call this project AONES. Specifically, this project had 4 objectives. 3 relate to the general EBS process we described before. 1, to develop and test what we call data pipelines that take in and process new data feeds in near real time. 2, to develop, train, evaluate, and deploy data pipelines, including AI components, that filter articles and extract critical situational awareness information. And 3, build an interactive dashboard that synthesizes this extracted information. There's also a 4th goal that takes a broader perspective on the project and the lessons learned about using AI. We'll be covering this 4th objective in another Public Health Ontario webinar on October 31st. The LDCP was a collaboration between several PHUs and Queen's University. We at KFLNA Public Health were the lead public health unit, and Nancy also represented the Department of Public Health Sciences at Queen's. Grey Bruce, York Region, and Leeds, Grenville, and Lanark Public Health contributed as our core team. Beyond that, we were lucky to have a large advisory group associated, including representatives from 7 other public health units, Public Health Ontario, and ODPRN. Between the core team and the knowledge advisory group, the project included experts in population health and epidemiology, individuals working in harm reduction, drug policy and health policy, and scientific experts. Additionally, we were fortunate to collaborate with ODPRN's Lived Experience Advisory Group, LEAG. We worked with all of these individuals during the development phase to determine the scope of the tool, and during evaluation phases to collect information that could be shared with new users of AONES on how they could use the tool. Participants provided insights based on their experiences regarding the information it offers, as well as any potential biases and limitations. Going back to our 5-step EBS data process from before, we can use it to outline the steps involved in the AONES data pipeline. In our case, the original data source is news articles sourced from something called the Global Database of Events, Language, and Tone, or GDELT, which I will describe more on the next slide. We then filter out all of the articles to only those related to the unregulated opioid drug supply. The scope, again, I'll describe this more briefly. And then of those in scope, we extract the relevant information, store it in a database, and display the data in visualizations in the AONES dashboard. The main data source used by AONES to capture news media is GDELT, which collects and monitors print and broadcast and web-based news media from around the world. It makes unprocessed lists of articles and their metadata available for free in near real time. While GDELT provides multilingual articles from around the globe, during data processing steps, AONES filters to only include English language articles from North America, The English-only requirement is certainly a limitation of the tool, but all that was within scope of the initial project. During the development of the tool, the core team and knowledge advisory group refined the list of articles within scope of the tool out of the broad range of articles related to opioids that are found by GDELT. During this decision process, the goal was to refine the articles to those that met the primary objective of the new EBS: to provide critical information on current and emerging threats in the unregulated drug supply, specifically looking for information related to circulating opioids and novel contaminants. In order to achieve that, we therefore had to exclude all sorts of articles on the drug crisis, which could be interesting. For example, articles on policies or harm reduction strategies. We then used multiple NLP and AI techniques to filter and classify opioid-related articles into two primary categories. The first being alerts, which are articles related to sudden spikes in overdoses, emergency department visits, and/or other negative outcomes. They may or may not include the names of specific drugs, their appearance, contaminants within the drugs, or specific outcomes. They are often provided by health or community organizations or the police for a specific region. The second being a crime. These are articles that name specific drugs seized by the police. They may or may not include descriptions of the form and/or appearance of the drugs or the quantity confiscated. While the focus of this category is larger drug busts, it can include individual possession charges. A third generic other category is used to capture articles that may provide information about the unregulated drug supply, but are less specific than the other two categories. Likewise, the core and knowledge advisory groups, as well as League, prioritized which information about the unregulated drug supply was needed to be retained from the article's metadata or extracted from the full text of the article. In addition to keeping the article's name, the date it was retrieved by GDELT, and the original URL, three types of information were deemed most critical. One, information about the location discussed in the article. Two, information about the drugs mentioned, including their name, the name of any other drugs or contaminants that might have been mixed with, their form and appearance, the quantity, the effect of the drug, and any information about its prevalence. And finally, information about the drug event and any specific subpopulations affected. Now, not all of these fields are relevant to all in-scope articles, and moreover, not all articles included all of these fields, even where they might have been relevant, but this is what we were looking for in general. Data extraction from the full text of the article is done using LLMs by providing the models with the full text of the article and prompting it to return the specific types of information taken only from the provided text. The LLM also determines relationships between individual data pieces. For example, which quantities are linked to which drugs in a multi-drug confiscation. There are limitations to these methods, and incorrect or inaccurate information can be extracted. We will discuss this more in the final section of the presentation, but to address this throughout the tool, we take a trust but verify approach, which always provides the original URL to the article to allow the user to verify the extracted information. And so now we've hit the most exciting part, the tool itself. This is only a very quick demonstration. Again, the hosted website includes further demos, including a YouTube video. As a preface, this tool was designed for computers and somewhat for tablets, but not for mobile devices, and many features will not work on mobile devices. And so here we are, the very first screenshot. The AONES dashboard is broken into sections for different use cases. Firstly, seeing recent drug alerts, which is 1 page. 2, tracking drug confiscations, also 1 page. 3, looking at recent themes in the drug supply, which is a total of 4 pages. And finally, exploring the full data set, which is 1 page. These are navigated to by using the second bar along the top here. Along the very top bar, you can, in the right-hand corner, you can see the last time the article was retrieved, and also a help button to bring you to the full documentation on the AONES on kflaphi.ca. Beginning with the first use case, recent drugs. This page includes the most current dashboardal articles that have been categorized as drug alerts. The page's purpose is to filter to a small number of articles to provide a quick and central place to identify events happening in the drug supply across the continent or in your local region. Articles and the data extracted from them are presented in 2 ways, in a table and on a map. In the table, we see the date the article was identified by GDELT, which is not necessarily when it was originally posted, the list of locations mentioned in the article, the original title of the article, a description of the drug event, including any specific subpopulations affected, the drug name, and any known drug details. As I mentioned previously, we also include the URL so that you can go back to the source and verify the information extracted. The map shows individual data points for each location mentioned in the articles meeting current filter criteria. Locations are always shown at the city municipality level. This is important because it both allows us to normalize the data, but also decreases the risk of stigmatization by not highlighting any more specific locations. The color of the data points indicates how old the most recent article in the location is, purple being the most recent and blue the oldest. If you hover over a data point, a detailed tooltip will appear. The page defaults to showing alerts from the past 7 days. You can switch to only alerts from today, the past 30, or 90 days using these filters. You can also change the geography using the dropdown. The dashboard defaults to only showing articles from Canada. In the dropdown, the geography will be organized by country, state or province, and city, and you can select any combination of them. You can also use the map lasso tool, as well as the zoom in and out, to temporarily select a subregion on the map, which will then filter the table. At any point, you can use the Clear Filters button to restore the default settings. The next page, Tracking Local Drug Confiscations, includes recent dashboard articles discussing drug seizures. The purpose of this page is to provide an overview of the types of drugs and any other known information about them that are being confiscated locally or across broader regions to provide insight into what drugs might be circulating in the drug supply. This page has a very similar layout to the previous. However, in the table, we see it contains more information extracted specific to the drug. Likewise, the tooltip on the map will contain slightly different information. There are then 4 pages under Look at Recent Themes, which use different methods and visualizations to provide insight into the themes found in the data over time and space. There is a row of buttons below the main use cases that allow you to navigate between these. The first page, the one we're on now, includes graphs showing the number of articles over time by article type: alert, crime, and other. The purpose of this page is to allow you to look at trends overall and in individual terms over time. 2 different indicators are used in the area graphs: number of articles by day and number of distinct locations by day. It is expected that these graphs will show similar patterns, but each indicator has limitations, so both are provided. Given the nature of the data source, media articles, the same event may be captured by multiple articles, therefore inflating the number of articles per day. In this scenario, the number of distinct locations should be more normalized, aka only count each event once. However, some articles mention multiple locations, sometimes within a small region, which can inflate that indicator. In addition to the graphs, there's a table on the right-hand side. When you have clicked on a specific data point in the graphs, the articles in this table will filter. It provides the title of the article, being included a link as well as a link to the original article to verify the content. We can also filter these tables and graphs with similar tools to the previous pages, as well as a date range filter to allow you to choose a specific time period of interest. Finally, there is an open search box that allows you to search for one of drug name, mixed with, form, or effect. The intended use of this page is to look up specific, newly emerging terms and see the frequency over time. For example, methamphetamine, a recent drug contaminant that is being used on this screenshot. The next themes page is Watch Over Time. This page provides a time lapse of articles on a map. The purpose of this page is to show the geographic movement over time of articles or specific terms, again, using the drug properties filter. To watch the data points appear over time by day, press the play button near the top left corner. The time lapse can be paused, stopped, or manually increased day by day using these other buttons. There are then 2 pages containing visuals surfacing concepts that have appeared more frequently recently than they did previously. One for each of individual terms, each of the main drug properties by themselves, and 2 for the relationships between the drug properties. The purposes of these pages is to highlight potentially emerging themes in the drug supply, with an understanding of the limitations of both the data source and the AI extraction. On each page, 2 options are available: emerging terms the last 7 days or emerging the last 30 days. The website contains more detailed information about the calculations used to determine this. Most of the data is displayed in visuals called tree maps. In these, the larger the box, the more frequently the term or relationship has appeared in the time frame. On this page, the term is displayed in the top left corner, if it fits. Otherwise, you could hover over a box to see the term. The relationships page, which we're on now, is very similar to the last terms page. On this page, the tree maps show the drug property here in the top corner and the drug in the bottom. The color coding shows the same drug property. For example, all of these are related to powder in blue, while all of these are related to pills in purple. A different visual is used to show the combinations of drugs and what they are mixed with. All the drugs are listed along the outside, are the individual drugs, with the size of the arc reflecting the frequency it occurs. The connecting bars show the combinations between the drugs, with the width of the bar reflecting the frequency of the combination. The final page provides a full listing of all articles captured in the dashboard in the past 180 days. The purpose of this page is to allow you to look for specific terms, locations, etc. To provide the greatest flexibility in searching, a whole pane is available for filters. This is what's in gray here. When you close the filter page using this arrow, the full data table of all extracted fields appears. For more information on using this page, there is on the website documentation.
And good afternoon, everyone. So I'm going to switch gears and briefly walk you through one aspect of our evaluation of the tool, and that is focusing on the insights we gathered from tabletop exercises. And we conducted these with two distinct groups, one being public health professionals from our knowledge advisory group, and the second being with individuals from our lived experience, from the lived experience advisory group. And also to ensure that we were getting unbiased feedback, both sessions were led by an independent evaluator who I assisted. And then through these exercises, we compiled a list of potential uses of A1s, as well as limitations, which I'll talk to you a little bit about today. So for both of the tabletop exercises, we began with a demonstration of the A1's dashboard, and then we followed that up with a group discussion focusing on 4 key questions. Those questions being 1, who might use the tool? How would they use it? 2, how does the tool's data compare to real world situations? 3, what benefits does the tool offer? And 4, what are the potential biases or limitations of the tool? So our discussions with the exercise participants identified 5 key potential uses for A1s listed on this slide. The first is that it could be used as a real-time news updates. So A1s provides real-time updates every 3 hours, a feature that was highly valued by the participants who currently rely on, for example, manual scanning of news sources or even Google alerts for similar information. Participants noted that this tool potentially allows them to stay informed about opioid-related incidents, overdoses, emerging drug trends as they happen, which could significantly improve response times. Next, movement of new drugs. Participants also highly rated the tool's ability to track the geographical movement of new drugs. Participants from public health agencies noted that A1s could help public health units monitor whether a new drug is seen in one region, perhaps especially near international borders, and if it is likely to spread to other areas, in particular their own. Again, this foresight may allow for proactive harm reduction efforts and preparation. Third, changes in the unregulated drug supply. In particular, A1's recent alerts and emerging themes features help identify trends in the unregulated drug market. Participants saw this as a key advantage, allowing public health teams, for example, to stay ahead of shifts in drug supply, such as the emergence of new substances, which would otherwise be more difficult and take longer to detect through traditional means. Guiding harm reduction initiatives. There was some discussion in both of our exercises that A1s may help harm reduction strategies at regional levels, and then to help tailor those monitoring efforts to specific locations. So by using A1's data, we may be able to identify emerging issues for specific communities and or neighboring areas, which may potentially lead to more targeted approaches. And lastly, exploratory analysis. Participants noted that A1s could provide researchers with data for exploratory analysis, such as identifying emerging themes or forming hypotheses based on the data over specific timelines. So although A1s was not intended as a primary data source, it offers valuable qualitative insights and perhaps supporting the broader public health research. But participants also pointed out some limitations that need to be carefully considered. First, bias in the data source. A1s relies on media reports, which can introduce bias. And certain opioid-related incidents may be underreported, misrepresented, or even sensationalized, depending on media coverage. Additionally, cultural and law enforcement biases may skew the way events are portrayed, and public health professionals need to interpret this data with these biases in mind when using the tool. Second, delays and repetition, in news reporting. The reliance on news media means there may be delays in reporting or repetition of the same incidents, which could affect the accuracy and timeliness of the A1's data. And furthermore, sensationalized headlines could lead to misinterpretation of the issues. Participants encouraged us to highlight the links to full articles should be used to gain a clear understanding of the events. Next, AI risks and data pipeline. The AI that powers A1s plays a critical role in detecting trends. However, participants raise concerns about, in particular, whether AI can accurately pick up on emerging drug contamination events. The AI requires continuous validation and adjustments to ensure it captures new trends effectively without missing any key data points. And lastly, the limited scope of this initial tool. A1s is in its early stages and cannot yet cover the full spectrum of opioid-related issues. And participants noted that the current version may offer valuable insights, but there's a need to expand its scope to provide a more comprehensive resource for public health professionals. So future developments should aim to broaden the tool's functionality to address the wide-ranging challenges posed by the opioid crisis. So to conclude, participants in the tabletop exercises expressed a positive consensus that A1s will be a valuable resource, particularly for harm reduction workers, public health professionals. Its real-time data capabilities and ease of use make it a powerful tool in opioid-related surveillance. But to ensure that it is used responsibly, we need to communicate the tool's limitations, including potential biases in the data, the risk of misinterpretation. Likewise, we need to develop a sustainability plan and to make sure that it is maintained and improved over time, and particularly by expanding its scope and developing a mobile version to enhance accessibility and user adoption. So we have included all of these notes and more in our documentation found on the kflaphi website. It's included with the tool. I encourage you, if you're interested in the tool, to first read through these notes and try to understand both the limitations and the potential power for this tool, both in our intended use and the unintended consequences.
Just we'll come back to questions, but before we do and open the floor for moderation, I wanted to thank you for listening and participating in our webinar today to launch A1s. Nancy and I really want to reiterate that we are presenting on behalf of a large working group that was critical to the development of this tool, especially our colleague Alex Hamilton, who is the main AI developer on the tool. If you are interested in learning more about the AI tools used and the broader findings we had about trying to do this type of project in a public health setting, Alex and I are giving another PHO webinar on October 31st. I believe the link to go that will be up in a few weeks. Otherwise, please feel free to contact Nancy or I at the following emails. And there's also a contact form on the website with the tool. So lots of ways of getting in touch with us. But now I will hand it back to Diana to moderate.
That's so awesome. Thank you so much, Allison and Nancy. Like I said, we'll now move on to the Q&A segment of this event to address some of the excellent questions that have been coming in from our audience. And everybody else, please continue to continue to type in your questions into the Q&A pod found at the bottom of your Zoom screen regarding the topic of today if you haven't already done so. And just to reiterate that there is a part 2 of this webinar that will take place on Halloween, so the 31st of this month. Okay, so questions for you, many. Okay, so we had quite a few questions, Allison and Nancy, about potential bias in media attention. So one of those questions and concerns was around potentially these media sources not producing accurate information about certain types of drugs, certain types of unregulated supplies, because this type of information is very infrequently reported, and when reported, it can be inaccurate. So wondering if you have any thoughts about that.
Absolutely. And we absolutely heard that, especially from the league group when we met with them throughout the development of this project. And that was one of the reasons we really broke it down into the types of the classifications of articles. The alert articles are typically, honestly, being reported back from public organizations themselves, including public health units. And so we generally find, and I've read thousands of articles at this point in the past year related to opioids, we generally find that the alert articles are a higher quality that make it through because they tend to be coming from organizations. And we hope that in that case, the tool serves as sort of a central gathering point, because while, you know, we may hear about alerts going across Ontario, this extends the geographic range that we can be paying attention to this. We, after talking to the league group, separated out the crime-related articles because we heard from these groups, especially related to the accuracy and police seizures and those sorts of things. So we've separated them out. We treat it with different level of context, but at the end of the day, unfortunately, we are stuck to the data that we are currently using. This was a pilot project. This was a single source of data. And all we can do is be very open about the limitations involved in it.
Mm-hmm. Yeah, I hear you. And related to that, so somebody else asked, with some of the fake news, quote unquote fake news that's, circulating, do you have any advice about how people can navigate sort of what's true and what's untrue amongst all these different news articles? Is there a function in AONES that filters out based on quality and reputation of the news sources?
Fortunately not. That would be a dream, but I don't even think that anywhere the internet is good enough to do that yet. But I would say that one of our trust but verify approaches is by always providing the URL. That generally will show you what news organization it came from, and there you can use that to judge whether you think it is a reliable news organization.
Thank you for that. We have another question about social media and alternative sources of information, actually. So quite a few people are wondering if there are any plans to increase the data source types that are used. So for example, social media, not traditionally considered mainstream news media. Do you have any thoughts about that?
We would love to. This was, as we said many times, a pilot project. We have so many different ideas of different sources, social media. I see comments about the drug checking services. We've heard lots of things, or wastewater. There's lots of things. We've even had conversations about how we would like potentially user-submitted content from individuals working in harm reduction reporting back to the tool. But none of this was in scope of the initial project. It was very much a pilot project, a test case, if you will, to see what was possible as we tried to bring in, this very different data source and build a data pipeline, which was an extremely large amount of work to get to where we are today. So we certainly have ideas about other ways we would like to add new sources of data and supplement the news media, which we understand has limitations.
That's awesome. Thank you for addressing that. A question about wastewater surveillance. So as you might be familiar with, there is currently some information that can be extracted from wastewater surveillance programs. So, for example, Health Canada has test programs for known opioids and emerging compounds, and some of these programs cover a fairly substantial population and scope. And so, wondering if there could be a future in which IONES incorporates wastewater surveillance data.
Absolutely. Just like with the social media and other data sources, we would love to have conversations. We've started conversations with individuals at Health Canada and with GFIN, who connected us to some of their colleagues as well about other data sources, all sorts of interesting things, so many ideas. But for this tool, we really had only 8-9 months to build it. So I could only really use a single data source, but open to all these ideas about where to go with it in the future.
On that note, though, to be fair, if somebody did publish, if there was the dashboard with the wastewater data there, and likely a news agency would pick up on any information that was in that dashboard that would be of interest, and that would be a news article that this dashboard in the state that it's in now would likely pick up. So in a roundabout way, it already would be doing that.
That's a great point. That is a great point. Okay, a question about the technicalities. So one of our webinar attendees is wondering, how do you measure the accuracy of the LMM model? And do you have any other models which are superior that you can compare the accuracy and precision to?
That is a fantastic question, and it elicits a much larger conversation, and I would highly encourage that conversation to happen at the second webinar, because we will really focus on the realities of trying to do this sort of work in a public health unit and where we are now and where we'd like to go from the AI perspective in that second webinar, which is all about that.
Which will be on October 31st.
Yes.
Excellent. Great. We have a few logistical questions, and then everyone can submit a couple more, and I think we're going to wrap up soon. But somebody was wondering if it's okay to share the link to AONES on their own websites.
Absolutely. We would just request that you link to the entirety of the website, so the kflaphi.ca/A1s. As we've said many times, there's a lot of documentation on that website, including a lot of us being very open about the limitations of this tool. And we really want to make sure that people have the opportunity to see that documentation when they go to use the tool, rather than embedding the dashboard directly. We're concerned that people wouldn't necessarily get all those other components. So absolutely, we'd love you to do that, but please link to the whole website.
Noted. Noted. Excellent. We do have another question about so potentially public health units that weren't involved in the initial testing stages. Will there be further opportunities to get involved in the future to pilot certain features or to provide feedback, test things out?
We're not totally clear on what comes next. I would say, like I answered the previous question, happy to have people use it. You don't need any formality. The tool is up and available for all on the website. If you are a public health unit and you're using it and you have thoughts, we'd love to hear them. There's no necessarily formal way of collecting that data at this particular juncture, but you can submit information on the contact us form on the website or email us directly. We're happy to have your questions, happy to have your thoughts, but there are certainly no commitments. The tool at this point is just live for you to see how it can help you.
Great. Thank you. Thank you for that. We have a question about monitoring. So somebody in the audience is wondering, how are you monitoring for new terms or drug names or other changes in language that might not get picked up by your NLP?
So one of the benefits of using the LLMs that we have is that they are less rigid than the initial models that we were initially testing. So they use different techniques, and we find that they are doing a pretty good job picking up things that we have never trained it on. That being said, there's obviously ongoing work. We will need, one of our big outstanding questions is sort of how we can sustain this tool and continue to dedicate the time to keep training, et cetera. I still do certainly training and annotating data sets of at least what sorts of articles or alerts, sort of the most critical ones, I still review on an ongoing basis to continue training models. But how we sustain this tool is a question moving forward. We were very lucky to get PHO LDCP funding for the first year, and they've supported us to continue running it from a technical perspective for another year, but we're looking for funding opportunities to continue the broader work.
Yeah, just to add to that, Alison, yeah, if anybody has any ideas and would like to talk to us about this, please do email Alison or I after this webinar, and we'd be happy to talk about how we can keep this going.
Noted. Excellent. And all of this information can be found on the website that's in the chat. Excellent. Thank you. Be sure to check out that website, everybody. Question. So somebody's wondering if there's any plans in the future to add a sentiment analysis to what you already have.
Not directly in scope. Again, this was a pilot project. We've heard all sorts of different ideas of where we'd like to go. But one thing that we considered from the very start of this project is, and as Nancy mentioned in some of the tabletop exercises, that we understand that by doing this, we may also be creating what we call sort of an exploratory data set. We will have a list of articles talking about the opioid crisis, and we would be interested in partnering with researchers potentially to sort of do a much more in detailed sentiment analysis and understand how the media reports on the opioid crisis. Would be really interesting to us, but certainly was not in the scope of this project.
Okay. Okay. We have a little bit more time for other questions. Okay. Just a question about other formats of sources. So news media that comes in the form of audio or primarily visual, like videos and things like that. Is that currently included in AONES or primarily text-based?
It is primarily text-based. The original data source, GDELT, does actually include a wide spectrum of things, but our data pipeline really only can process it in text. We do not have any methodologies yet where there's not a transcript or something of the content. It really can only pick that up. But it's a good point that there are other forms of that as well to consider in the future.
Amazing. Okay. Okay. I have one more question here. So somebody in the audience is wondering if you could please describe your familiarity with community-based drug checking services. For example, Toronto has a drug checking service which monitors the unregulated drug supply in real time, which uncovers and publicly disseminates and educates on novel substances and trends. So wondering, so for example, have you considered how to account for this concrete information on the composition of unregulated drug supplies, which might not be picked up by the media?
Yes, so I will not by any means claim to be an expert in harm reduction. That is not my background. We were lucky to collaborate with many individuals who do have that background as we did this project. And I would say that like many of the other sources that we've done, sort of at various points during this project, we considered compiling a list of websites that we wanted to monitor, including all of the 34 public health units in Ontario and these sorts of things where we thought we could get information. And again, due to simple realistic timing, it was unfortunately not doable. As it was, this project was very hard to achieve within the scope of the time we had. But again, these are all sources that are really interesting to us and we'd love to consider and how we can add them into the pipeline in the future.
And I think just to add to that too, that that we present this as a complementary surveillance tool, not to it's not to take over everything else, but definitely just to be a complementary tool, another source of information.
Good. Excellent point. Thank you, Nancy.
More for collaboration and to expand what we already have. That's so excellent. Excellent. So we do have a couple more questions, but we are running low on time. And I do want to remind everybody that there is a follow-up session on Halloween, October 31st. So if that is okay with our speakers today, we're going to wrap up. And if anyone has any pressing questions, again, our speakers have their contact information that you can reach out to. But for the remainder, we really want to thank Allison Mayer and Nancy Slip for presenting and everyone who joined us today for the webinar. Participants, you can expect to receive a brief and anonymous PHO round survey for today's session. Please do try to complete this because it helps us improve our programming. And lastly, if you want to access any past PHO presentations and to view confirmed and upcoming sessions, please visit the PHO website, head on to the Education and Events section and click on Presentations. Thank you, everybody, and I hope you have a wonderful day.